Welcome to Healthy Habits. We are so glad you found us. Here at Healthy Habits, we are dedicated to helping you live your healthiest and happiest life. Our channel is all about sharing practical tips and advice for improving your nutrition, staying active, and maintaining a healthy lifestyle. Whether you're looking to lose weight, boost your energy levels, or just feel better overall, we've got you covered. Our team of experts will provide you with the latest research and recommendations for living a healthier life. So join us on this journey to better health and wellness. Subscribe to our channel and hit the notification bell to stay updated on all of our latest videos. We can't wait to share our healthy habits with you.
Early warning signs of colon cancer you should not ignore. Colon cancer is often called the silent killer because there may be no symptoms until the tumor has become large enough to cause problems. Over 100,000 new cases of colon cancer are reported each year in the U.S. Colon cancer is actually the third most common cancer in both men and women and is responsible for nearly 50,000 deaths each year. Colon cancer, also known as colorectal cancer, is a type of cancer that develops in the large intestine, colon, or the rectum. It typically begins as a small growth, polyp, on the inner lining of the colon or rectum, and can gradually grow and spread to other parts of the body. Please note this video is for educational purposes only. If you have any medical concerns, please do speak to your doctor. That said, let's jump in and talk about the early signs of colon cancer. Changes in bowel habits. This can be a sign of colon cancer because the tumor can obstruct or narrow the colon, making it difficult for stool to pass through. This can result in changes in the frequency, consistency, or size of your bowel movements. Additionally, as the cancer grows and spreads, it can cause inflammation and irritation in the colon, which can also lead to changes in bowel habits. Diarrhea. In some cases, colon cancer can cause diarrhea if the tumor obstructs the colon and leads to a partial blockage. This can cause diarrhea because the colon is not able to properly absorb water from the stool, resulting in loose or watery bowel movements. However, in most cases of colon cancer, constipation or changes in bowel habits are more common symptoms. The National Cancer Institute reports that some people may experience diarrhea because their colons are infected with bacteria or parasites. Constipation. It can be a sign of colon cancer because it can occur when the tumor obstructs or partially blocks the colon. As a result, stool can become harder and drier as it remains in the colon for a longer period of time, leading to difficulty passing stool and infrequent bowel movements. In some cases, people may feel the urge to have a bowel movement but are unable to do so. Constipation can also occur when the colon is inflamed due to the presence of a tumor, leading to narrowing or restriction of the colon. Inflammation can also cause changes in bowel habits, such as alternating between constipation and diarrhea. According to one study, more than 80% of patients diagnosed with colon cancer had experienced constipation before their diagnosis. Constipation can be caused by a variety of things, including medication side effects and a lack of physical activity. Sometimes it's hard to tell the difference between normal constipation and something more serious like colon cancer. If you're experiencing constipation that lasts longer than 3 days, talk to your doctor, especially if other symptoms such as bloody stools and abdominal pain are present. Blood in your stool. It is also known as rectal bleeding or hematochezia, which can be a sign of colon cancer. Colon cancer occurs when there is an abnormal growth of cells in the colon or rectum, which can bleed and cause blood to appear in the stool. This bleeding may not always be visible to the naked eye, and it may only be detectable through laboratory tests. The 5-year survival rate for colon cancer is 95%. Unfortunately, 1 in 20 Americans will develop colon cancer during their lifetime. The earlier it is detected, the higher the survival rate. Bloody stools can be caused by many different types of cancer and other conditions such as ulcerative colitis, diverticulitis, hemorrhoids, inflammation or injury in the large intestine. It can also be from bleeding from other parts of your digestive tract, such as from ulcers in the stomach. Unexplained bloating or abdominal pain. When colon cancer grows and spreads, it can cause a blockage in the colon, leading to a feeling of fullness or bloating in the abdomen. The blockage can also cause cramping and abdominal pain, which may be severe. Fatigue. One way that colon cancer can cause fatigue is through the development of anemia. Anemia is a condition in which the body does not have enough red blood cells. Red blood cells are responsible for carrying oxygen throughout the body, and when the body does not have enough of them, it can lead to feelings of fatigue and weakness. Colon cancer can cause anemia when it causes bleeding in the gastrointestinal tract, leading to a loss of blood and a decrease in the number of red blood cells. This can be especially concerning if the bleeding is chronic and ongoing, as it can lead to long-term anemia and persistent fatigue. Sudden weight loss. It can be a sign of colon cancer, especially if it is significant and unexplained. One way that colon cancer can cause weight loss is through changes in the body's metabolism. Cancer cells consume a lot of energy and nutrients, which can lead to weight loss even if a person is eating normally. Colon cancer can cause changes in the body's metabolism, leading to an increase in energy use and a decrease in appetite. This can result in weight loss over time. Another way that colon cancer can cause weight loss is through changes in the digestive system. When colon cancer grows and spreads, it can cause a blockage or narrowing in the colon, which can lead to changes in bowel movements and digestion. This can cause a loss of appetite or difficulty eating, leading to weight loss. In addition, if colon cancer spreads to other parts of the body, such as the liver or lungs, it can cause changes in the body that can lead to weight loss. Cancer cells can release substances that affect the body's metabolism and cause weight loss, even if the cancer is not in the digestive system. Feeling full all the time. If you're feeling full at the time even when you do not eat food, this could be a sign that you have a problem with your digestive tract. Colon cancer may cause bloating, constipation, diarrhea, and other digestive issues that make it difficult for people to eat normally. These symptoms are often mild at first and are generally easier to ignore or dismiss than other symptoms of colon cancer. If one first-degree relative such as a parent, child, or sibling has had colorectal cancer before age 55, you have a greater risk than average of developing it yourself at some point in your life. African Americans have the highest risk of developing colon cancer than other races and ethnicities in the U.S. Although this may be due to differences in access to screening tests rather than biology alone. Remember, if you have any of the symptoms discussed above, do not wait before contacting your doctor.
Thank you for watching this video on healthy habits. We hope you found the information helpful and are motivated to make positive changes in your own health and wellness journey. Don't forget to subscribe to our channel and hit the notification bell to stay up to date on all of our latest videos. We post new content every week, so there's always something new and exciting to learn. If you have any questions or comments, feel free to leave them in the comments section below. We love hearing from our viewers and always do our best to respond to your comments. Thanks again for watching, and we'll see you in the next video.